Okay, man, I'm going to record this so I can share it later on with my other classes. So could you please introduce yourself to my class?
Sure. So hi, everyone. My name is Amanda Korenoski. I now live in the North Hills, but I'm originally from Brownsville. Right now, my current roles are I'm the managing director of the Pittsburgh Poison Center. So if you've ever seen the green Mr. Yuck guy, that's my life. I don't know if Eric has one in his room or not, but certainly have. We'll get you some.
I'm wearing my mask.
Oh, perfect. So that is my life. Perfect. So that's a big chunk of my job, and we can go into that if you guys are interested. The other two pieces is I'm the pharmacy director for all of the outpatient pharmacists at Presbyterian and Shadyside UPMC hospitals, as well as in charge of the regulatory stuff, which is all about outside places coming in to inspect the hospitals and pharmacies to make sure they're following regulations. And then finally, a portion of my job is teaching at Pitt. So I'm a faculty member at the School of Pharmacy.
I'm going to ask you, when do you have time to do anything else?
What was that?
When do you have time to do anything else? Because what you're telling me sounds like a lot of work.
It is. So I originally just started out at the Poison Center, and it really became a passion of mine. I went to pharmacy school, did some training in administration and critical care. So I wanted a place to go where I could use some of my clinical pharmacy skills, but then also, lead a team. And that went really well for 6 years. And then my boss left, and they kind of said, hey, would you like some more responsibilities? So it's hard to pass up on that, but it's also difficult to say yes. So what I found critical to making this transition, and those extra roles only came about in the last couple of months, is I've really put a larger emphasis on putting the right people in the right places, asking for help, delegating, but really setting up my teams for success so that I don't have to be in a million places at once doing everything, because everything is bound to fall apart if I do that. I can't be everywhere at once. So one of the things I really like about being a manager and director is that I can bring out people's strengths and put them in positions to succeed. So example, I have somebody in the Poison Center who has been with us for a long time, and she's taking some classes and she's found like another area that she likes. I don't expect her to be with me until she retires. I know that I'll be in the same position for the next 40 years. So I'm not trying to keep her forever, but I would like to hold on to her as long as she still sees herself as part of the Poison Center. So with me in this different role, I'm really identifying things that she would really be good at and trying to give some of those things to her to let her grow professionally, then also help us out in the big picture. So I like being able to work with people and helping them grow. And so I guess to answer your original question, a big piece about my transition has just been putting the right people in the right spots so that I have help.
So when you were in high school, what classes did you take? And did you always know that you wanted to be a pharmacist?
No. So both my dad and my grandfather both went to Pitt Pharmacy. So I grew up saying there's no way I'm going to Pitt and there's no way I'm going to pharmacy school. I got a scholarship to go to another university. Really liked it, was really excited. And then I visited Pitt and it just kind of clicked. So I still wasn't, convinced that I wanted to be a pharmacist. So I kind of went, I guess I considered myself pre-med, but I wasn't tied to medical school at the time, but kind of went and took some science-based classes. And I was one of those annoying campus tour guides that you guys will inevitably see if you go start to visit schools. And one day I got assigned to the pharmacy school. So I was responsible for like taking people up the hill to the pharmacy school. And then once we got there, the pharmacy school leadership would take over the tour. But as I was listening to them, I started thinking like, man, I didn't know pharmacy could be more than what I knew it as by what my dad and my grandfather did. So I talked to them, and I actually shadowed somebody while I was in college as pharmacist at UPMC. And I told him, like, please don't tell my dad that I'm here. I just want to do this. I need to make my own decision. And so he set up a day for me to shadow in the hospital. So I got to see what pharmacists did on the units and how they talked to patients and made decisions for like critically ill patients. And it really clicked for me. So that person I shadowed eventually became my boss, and is now the one that left and went to Duke. So another thread of that story is it's a very small world. In high school, I took science classes and AP classes. The AP classes that I took, there were only a couple available at the time. I don't think I translated any of them to college. I think I could have skipped, I don't know, Bio 1 or something like that, or Calc 1. But I didn't feel like I was ready, so I retook the course in college. But in high school, I tried to, be well-rounded. I was involved in drama and dance. I played the piano, but then I also did sciencey things and, took on some leadership roles within the school. So I just tried to be well-rounded, and I think in the end it worked out.
So you mentioned your father and grandfather were both in pharmacy. Are they in the same type of were they in the same type of pharmacy that you're doing now, or is it different?
No, different. So my grandfather owned a community pharmacy, a little retail pharmacy in downtown Brownsville for many years. I kind of grew up in that store. I mean, there's all kinds of pictures of me, playing with the empty pill bottles in the office. And there was a play cash register in my grandma's office that I played with all the time. I remember sneaking candy from the cash register. It was allowed every once in a while, a little display. But I knew him as a community pharmacist. That, I don't know, maybe I'm just an introvert, but I didn't like all of that, like constant patient counseling, people, coming in, really focused on the drug and selling that drug, kind of, if that makes sense. My dad is still the director of pharmacy at Uniontown Hospital. So he was only in pharmacy administration. And I guess that's kind of where I ended up now, but I saw him constantly at home working on the schedule with like papers across the table. And I heard him talk a lot about, managing people. And at the time, I really was looking for some place to really interact with a complex, sick patient. I always saw myself in a hospital somehow as a nurse or a doctor. I wasn't so interested in the community site where, there's such a focus on, getting the drug to the patient, which is very, very important. But I didn't see myself working in a community pharmacy all day. And then I didn't see myself being a manager or director. So I didn't understand that there were lots of other areas of pharmacy to go to. And at Pitt, I guess I'm a little biased now because I'm part of the faculty, but the people that design the curriculum, they really put an emphasis on where all a pharmacist could be and why we're important to multiple areas of the healthcare world. So I have students now that have gone to work for drug companies. I've had people that build their own business. One of my students does IT tech consulting. I have lots of people that have gone to become unit-based pharmacists, clinical pharmacists, where they round every morning with physicians and they look at the patient's drug list and talk and help them make decisions. We have pharmacists on the inpatient side who do discharge counseling, so talk to patients before they go home. Pharmacists in outpatient clinics. So I don't think I understood at the time all the different avenues that I could take it. I think I was just kind of limited to what I was used to and what I grew up as. And I'm sure that there was a piece of it too, you kind of want to become your own person and you don't necessarily always want to do, I don't want to say anybody expected me to become a pharmacist, but you kind of want to figure things out for your own. So I'm sure that was a piece of it too. So
your husband is also a pharmacist, correct?
He is. He's right above me working from home now. So I met him, we were both interns at UPMC Shady Side. So he was a hospital intern. He went to Duquesne, which is also a great school. When he was done, he stayed at the same place we did our internship, and he specialized in oncology. So he was the pharmacist that was on the inpatient side that was like mixing the chemotherapy and verifying orders. And there are a lot of very specialized instructions that go with those IVs and those oral meds. So he kind of focused in that. He later became the lead for the investigational drug services. So if there was ever a study going on, he was the one to make sure that the drug was stored in the right way, prepped in the right way, was dispensed to the appropriate patient. But about 6 weeks ago now, he started a new job where he's with specialty pharmacy. And this is another area that I don't think I knew existed up until a couple of years ago. And I still don't know the whole world of what he does, but they deal with very, very, very expensive drugs that deal with very, very specific disease states. So they're a nationwide company. So he's calling patients and prescribers from all over that have these very, very specific genetic disorders, metabolism, endocrine disorders, and he helps get that specialized drug to them, which sometimes involves dry ice and all that stuff, special infusion pumps. He helps get that to them and then counsels them over the phone, what this drug is, what's used for, what to expect. So he goes into the office sometimes because it still is a pharmacy that has to dispense drugs. So he goes to Robinson every once in a while, but for the most part, he is able to work from home with this role, which was exciting for us as a family. We have 2 young kids.
So if you did not go into this type of pharmacy, was there another one that interests you?
Another area of pharmacy. I knew that I liked the hospital. So I think I always saw myself as like, I didn't want to be a jack of all trades. And maybe that's why community pharmacy wasn't as attractive to me either. Like I wanted to become an expert in something. So after graduating from pharmacy school, I did a thing called a residency, and it's not mandated for pharmacists, but it's just a way to go in and do additional training. And I chose critical care. So I did my training and rounded with really sick patients on ventilators. I liked it because they had so many things going on that by fixing one problem, you might have been creating side effects and would have to address the other, or they had an infection where some drugs you couldn't use. It was kind of like a big puzzle piece. So I really liked that. So I thought that maybe I would round on patients and be that kind of hands-on, but now I'm kind of a little bit of a step back. But I will say, and I tell my students all the time that come to pharmacy school, I didn't know what I wanted to do until honestly one step ahead. So I didn't go to college knowing I wanted to go to pharmacy school. When I was in pharmacy school, I had no idea that I wanted to do a residency. When I got to my first year of residency, I didn't know what I wanted to specialize in. And then once I specialized in it and graduated from that, I didn't know the Poison Center was an opportunity. So I think it's okay. It's great if you already know what you want to do, and definitely by all means pursue those dreams. But it's also okay if you don't know what you want to do. And I'm fortunate to have, a strong family behind me, but also a lot of really great mentors that I've met at school and through some other extracurriculars. And I think some of the doors that have opened up for me, not necessarily getting jobs, but just opening up new ideas and new possibilities, came from having those strong people in your life. So if you don't have a mentor, seek one out, because they can really help you bounce ideas off and help you figure out what that next step is.
So let's move over to the Poison Control Center. How long have you been working there?
So it's been a little over 6 years. There are 55 poison centers in the country. One of them, obviously in Pittsburgh. We're part of UPMC. Every poison center, so if you call the 1-800-222-1222 number that's on Mr. Nuttall's mask, if you call that, you will get routed to one of these poison centers. The people that answer the phone are either a nurse or a pharmacist. We call them spies, specialists in poison information. So kind of cool to say I work with spies every day. And so we get calls from all over. Whether it's a mom, my kid, got under the sink, and got into something, what should I do? We had a lot of older patients who accidentally took, double their medication. They took one dose and then later on didn't remember that they took it and took it again. But more and more, we're getting calls from hospitals who have this very sick patient show up and they do some lab work and they figure out that they were exposed to something and they just don't know what to do. Because we cover about 2/3 of the state of Pennsylvania. So if you think about, what that means, we have some big hospitals that we cover, EPMC and AGH and Allegheny Health Network, but then we also have some really small rural areas that just don't have access to the things that we do, these expensive antidotes or expensive tests. So we can help facilitate that over the phone. We save a lot of healthcare dollars and avoid a lot of people going to the hospital. So about 90% of calls we're able to keep at home. We just did a study, what I presented on last weekend to a conference was that we did a rough estimate of what people would do without a poison center. And we took the results of that survey and applied it to if there was no poison center, how many extra people would go to the emergency room unnecessarily, how many people would go to urgent care or call their PCP. And we estimated that in the state, the poison centers in Pennsylvania save about $62 million a year in healthcare funds. So it's pretty cool to be a pharmacist and a clinician in this kind of random, area of the poison center. Toxicology is certainly a subspecialty. And yeah, I'm really proud of what the team is able to do. You never know what's coming in on the other line when they call. So it kind of makes it fun.
Have you ever dealt with a phone call before?
I have not personally taken a call. These people that have been doing this have been doing it for a really long time and really are the go-to experts. And so, in pharmacy school, they didn't teach me necessarily what to do if like a black widow spider bites you or a scorpion bites you, or I don't know, these off the wall kind of crazy things. And they're all trained to handle anything, snake bites, all that stuff. So they go through specialized training and have to sit for an exam before they're able to start taking calls. So no, I haven't taken any calls, but they have a hard job ahead of them. And that kind of goes back to what I was talking before about capitalizing on people's strengths and making sure they have the resources that they need to be really successful at what they do. So that's kind of my job is to support them.
So that's interesting because I would have never thought, I don't know if you guys would have either, but you deal with like snake bite, spider bite, stuff like that, not just chemicals and medications, stuff like that.
Yeah, really anything. We have to be prepared for, people keep all kinds of exotic snakes as pets. So even though, a snake might be limited to like Australia or something, there's a chance that somebody in Pennsylvania could have it. So we have to be prepared for all of that. Super rare things, but then also different combinations of things. So if somebody overdoses, how many different types of medications did they take? How much of it did they take? And then how can we sort through their symptoms? Our rule of thumb here that we always talk about is that anything can be a poison if you take enough of it. And that's very much, I think, true in our line of work. Several years ago, probably 10 years ago now, there was a woman who actually died in the state of California. They had a radio show contest, and the contest was to drink so much water. Whoever drank the most amount of water and didn't go to the bathroom would win the contest. So this woman, I don't want you guys to think that water is poisonous, but she drank like dozens of gallons of water and actually threw the electrolytes in her brain off and died. So, everyone drink your water. It's important to stay hydrated, but really anything can be a poison if you take enough of it. So we're a free service to the public. So a lot of what they do is reassuring people that they'll be okay. But if they're not okay, we can help get them to the right center to be treated and make sure that that center has the drug that they need.
This popped in my head when you said that. Have you ever dealt with someone that has taken medication, either not for them or a type of animal medication, thinking that it was the same thing?
Yeah, Yeah, for sure. And I think COVID is a great example of that. I mean, we've been getting calls about people who hear about ivermectin on the news and go and buy it at an animal feed store and take it, and that can be really dangerous. When hydroxychloroquine was popular in the news with COVID, maybe about a year ago or more, there was a couple in, I think, Arizona, who found that chloroquine, kind of another form of hydroxychloroquine, was in fish tank cleaner. And they were so afraid of getting COVID that they ate this fish tank cleaner to try and get chloroquine in their body, which they thought was a good thing. One of them got very, very sick and the other one died. So we get all kinds of, we have to watch the news very carefully. When the Tide Pod Challenge was a big thing, we got a lot of cases called in. If you take enough of that, it can hurt your esophagus. But the concern that we were seeing were people were biting into the Tide Pods and the liquid was splashing up and causing eye injury. So we watch, in fact, in the Poison Center, they always have the news going because we're always looking for, is there an emergency happening in our area? Nationally, are there bioterrorism threats? Is there a suspicious odor coming from a factory in our area or something like that? We always are watching out for trends or emerging news stories to make sure that we're equipped to answer those calls.
So when they approached you to head up the Poison Control Center, did you realize what it dealt with? Or were you just thinking phone calls?
Yeah, so my knowledge of the Poison Center was pretty much, one, it existed because I knew where their office was and I walked by it a lot. And two, when I was in pharmacy school, I had to memorize the 1-800 number for an exam. And that was pretty much it. So I knew that they took calls, but I had no idea the scope of calls that they took. So it's been fun to learn about what they do and partner with our poison centers across the country. I think the one thing that I wasn't prepared for was all the extra stuff that was going to come with it. So I was ready to lead a group of people, and sometimes I'll go with the tox team and see patients on the inside and the inpatient side. But my job has kind of morphed into being, doing a lot of government advocacy work because we're funded primarily by the government. So I do a lot of advocacy work. I do some research because that helps, one, us know better how to treat patients, but two, it helps promote poison centers and again, shows their importance. I've learned marketing. So who would have thought I would have helped design a mask or, use stickers and coloring books and selling t-shirts online and that kind of stuff. That's not something I learned in pharmacy school. Mr. Yuck just turned 50 this past year. So I helped get some of the buildings downtown to light up green. So all this other stuff that I never thought I would have to do. I'm writing a contract right now with one of the largest drug companies in the United States so that we can start taking some of their calls. So I've gotten a crash course in industry client contracts. So while I have lots of support from UPMC to do those kinds of things, it's kind of been all that extra stuff that surprised me after taking this job.
Just to let you know, in the 70s, we learned the phone number when we were in elementary school. They actually had us learn it.
Yeah. Well, then you didn't have the 1-800 number, did you?
Yeah. Oh,
okay,
yeah.
good. Because the local number is
I can't remember it, but I think we had to look. I remember we memorized one of the two numbers. I do remember that.
Yeah, when I started going out into the community and doing some public health fairs and things like that, these people kept coming up to me and singing this jingle of the phone number, and I didn't know what they were talking about. Turns out that, so the number was 681-6669, and it was I am sick, I ate 1-666 upside down 6. So I finally figured out what they were talking about, and that's still our local number. But the 1-800 number is easier now because if you're traveling, you can get another poison center.
Okay, so it goes in the region. Yeah.
Yep.
People my age remember the commercial, the PSA that ran, which was really creepy, just to let you know.
You should play it. It's on YouTube.
I will play it for you. So moving now into, we've been talking about how important communication is. in class and being able to do it. You said last weekend you had to give a presentation to a large group. Do you get nervous before you speak in front of large groups?
Oh yeah, I hate it. I'm not good. I'm not a good presenter. I I don't even love teaching. I mean, I love teaching, but I don't like standing up and giving a lecture. So I even did the courses that I'm designing, I'm very much trying to avoid standing at a podium and talking because I can't stand it. So a lot of my classes are very interactive and I have to like walk around and work with small groups. Presentations are also very challenging. This one was virtual, which helped. I didn't have to look at, a huge room of people. But it was an international conference. So like the person who introduced me was from Italy and the person presented in front of me was from France. So it was very intimidating. I wish I had a cure for it. I really don't. Practice helps. In fact, this research project that I'm on, it kind of came down between me and then one of the doctors I work with, and he was busy and he said, I can work with the conference people to rearrange it and I'll present if you don't want to. And I said, I'll do it. It'll be a challenge and kind of force myself to do it. I take lots of deep breaths, but it's something that I've come to realize it's a part of my job, and I just take lots of opportunities to practice. I feel like I did a lot of public speaking in school, but I don't know, there's something different about it, being a part of your job. It rattles me a little bit.
You remember your first public speech?
I do.
And where was it at?
I don't know if it was at the high school, as an auditorium. I helped give a speech to advocate for Route 43 to be built.
Yes.
I think I was roped into that by some family members to have like a 10-year-old stand up there and describe how important it would be to have that road built. But yeah, that was one of my first forays into public speaking.
So that was 10 years ago. No, it wasn't 10. You were 10. That was a long time.
I think I was 10. I was young, elementary school.
So when you teach, you say you don't like getting in front of the class and teaching. Is that how large are your classes that would be that give you that fear?
Yeah, so I teach in different parts of the curriculum at different times. So I never have like a full year of teaching. In the fall, I teach half of a semester. So I see students on average of 4 hours a week for like 2 months. And I teach management and leadership and finance and budgeting and all that fun stuff. Our classes are 125 people. So I teach the whole year of Pitt pharmacy students, and the classes are about that size. I think it's gotten better as I've gotten older, but for a while, I'm still young. I'm not quite in, I don't think I qualified to be in my mid 30s yet. I'll still claim the early 30s. So it's hard when one of my students right now said that she's 31. So it's only a couple years younger than me. And I get intimidated by that. But, I've learned kind of what I'm good at and what I'm not. And I think I'm better at smaller group discussions. So I try my best to make my large kind of formal presentations limited, and then try and do group work to kind of, because that's more my comfort zone. And I think students like that in the end.
So you mentioned management and finance. Do you have a background in that?
No.
Just come along with the pharmacy? Yeah,
so I just had to figure it out. First time I was given a grant budget or grant and said, come up with a budget. Here's $225,000. This is what I want in the end. Tell me what you need to spend to get it there. I was at a loss. So, again, to public speaking, recognizing what you're good at and what you're not. You're never going to be good at everything. I learned quickly to know when I have to ask for help. And there are lots of people whose careers are built on accounting and finance and grants management. So I have some good partners to reach out to when I have questions.
Any of you have any questions? Because honestly, it sounds to me like she's done everything you could probably ask, and she probably has an answer for it. Anything else before I let you go you'd like to share with these guys?
Hmm. I think the things that I tell my pharmacy students that are probably just as relevant to you guys are, I think I said already, make sure you have a mentor. It doesn't have to be a mentor and exactly what you want to be when you grow up. One of my strongest mentors right now is in radiology, which is super different than pharmacy, but he's really helped me talk through some of the challenges that I face in management, and I've got to know him personally. So seek out a mentor. They're helpful on a professional and I think personal level to just have somebody that's been through what you're going through, or at least something related to that. And then just figure it out as you go. It's weird to like sit here and talk about my role because I don't know, I don't like bragging or talking about it that much, but really I didn't know that I didn't set out saying, by the time I'm in my mid-30s, I want to be the director of several departments and a large, couple of hospitals. I honestly just figured things out one step at a time, and it's worked out for me. So find a mentor, take deep breaths, just go one step at a time, and just make sure that you have support around you so to help you make those decisions. Because I don't mean to sound like everything's been sunshine and roses and rainbows. It's definitely been difficult at times, but if you have the right people around you, they'll help you pull through.
One thing popped in my mind when you were talking about that. With COVID and stay-at-home orders, you were considered an essential worker, right?
Yeah, for the most part, I still ended up going in for a while. The Poison Center is unique in that we have some accreditation standards where we have to have people on site during kind of business hours / peak call times. But we can have people working remotely, and it's actually good to have people working remotely, because if something were to happen in Oakland at the hospital and all of our phone systems were to go down, I could have people hop on from their phones and continue to keep the Poison Center operational. So when COVID hit, I was pretty much only over the Poison Center. I didn't have these other areas under me. So there are times where I'd be remote because my staff was remote, but we definitely needed to keep the Poison Center running. We ran and still run a COVID hotline for Allegheny County, where if people have any questions, they can call us. We were helping 911 triage COVID calls for a while. So COVID definitely took a hit on the Poison Center and really had us thinking creatively. We're already a 24/7 operational nurse hotline. What else can we do to pivot during the pandemic and help? So yeah, COVID was a challenge for everyone, and it certainly flipped the Poison Center around a little bit.
So now I want to know, what questions were you able to answer about COVID?
So the health department was not prepped to get the call volume that they were. In the beginning to middle of March 2020, they were starting to get calls. And we had talked about setting up a line where people could call, or they could route calls to us. But one Friday at like 4:30, they were like, we can't handle it anymore. You need help. And so we kind of threw together some like basic frequently asked questions and gave it to my staff. Luckily they're all nurses, and before coming to the Poison Center, they either practiced in the ICU or the emergency department. So they were able to pick up on that information pretty quickly. But in that first couple of days, we answered like 700 calls in the Poison Center. I was taking those kinds of calls, set myself up in my sweatpants in a corner of the Poison Center. We kept ordering pizza through the day, and as soon as we set the phone down, it would ring either with another COVID question or another poison related question. So we answered basic questions like in the beginning, I don't know if you guys remember, couldn't find tests. People didn't understand what quarantine meant. So we did all of those things. For a while, we were helping first responders that were exposed at work. So if they were a police officer, firefighter, EMS, and they got exposed to COVID, we were helping connect those people with rapid testing. And then the 911 partnership was interesting. We were afraid that people were going to start calling 911 just to get a test, because testing was so infrequent in the beginning. And EMS was already stretched too thin. So we set up a process where if somebody called, they would get routed to us. And while EMS was responding, we would kind of triage their COVID symptoms and figure out if they really needed to be seen by healthcare providers. And if we weren't, then we would follow up with them on the phone in the next several hours to days and kind of save them from taking up a hospital bed. So yeah, it was interesting for sure.
Well, Amanda, thank you very much for taking time to talk with us today. I really appreciate it.
Yep. Best of luck, guys.